Hi, this is Jody Colegrove with Quantum Techniques. We have the most diagnostic form of energy medicine in the world today. Here at Quantum Techniques, or QT as we like to refer to it, we work with people all over the world on the phone, helping them determine why they're having a health issue and what they can do about it. So today I wanted to kind of just talk about what a QT treatment is, okay? And so a lot of times what happens is if you have had an issue, it could be a surgery, it could be a life event, it could be a trauma, it could be an accident, you name it, but you have a health issue that you're not sure what to do, okay? So you would call us and say, okay, fill out a client history and say, this is my issue and this is some of the things I eat, these are some of the things I put on my body, this is what I've experienced, this is maybe medications I've taken or certain modalities I've done to try to heal this, and I'm kind of not sure where to go next, I'm not getting some healing, what do I do? So we read through that and we kind of get a picture of where we need to work with you on, and what we do is we then get on the phone and we have a consultation. We offer our clients a 60 minutes worth of testing if you're new to Quantum Techniques and a client. And so what we're doing when we get on the phone is we first need to identify what's going on in the body, and we do that through muscle testing, okay? And there's lots of different methods of muscle testing, and I have another video on that you can watch. So what we do is we want to make sure that you're not reversed, and so we make sure that you're, by tapping side of hand, under nose, side of hand, that gets you to stop being in reversal. The next thing we do is we want to make sure that we don't have any spiritual attachments or other people's energy that are impacting you and not allowing you to have really good testing. So we go through a series of questions to clear what that may be, and they may be some beliefs, it could be generational issues that have come in, it could be a person, and so we find out what that is and we clear that so we have really good clear testing. The next thing we do is we want to make sure that, okay, let's say you've had anesthesia. The purpose of anesthesia is to keep things from functioning or be asleep while they're having a surgery. Well, sometimes when they wake you up, there may be some tissue in your body that doesn't wake up. And so we want to make sure that with the issue you presented us with, that we have a really clear, that your body can see it completely, okay? So we have certain things that we go through. So we have cranial nerves in the face, we have the sutures in the head, we have the spinal cord, we have the teeth, we have cortical contacts that are all in our head, we have certain detox pathways that we clear, we have brain engines, and so we're going to take all of that, neurotransmitters is another one, we're going to put all of that and make sure it's all communicating. So we're going to run through that. The next thing is we have something in our bodies that is created called curtains. In other words, we feel that what the body can see, it can heal. And just like anesthesia, some things can cover up and not allow the body to see. So I used to do a lot of play acting as a kid in high school and stuff like that. And so what I find is that when you think about a stage, if you've ever been on a stage, the people in the audience can see the stage and they see actors come in, they see props drop, and everything's happening and it's a story. Behind the scenes, there's these curtains that are like there's like 3 before the back curtain that are angled. And as an actor, I can look out and I can actually see the audience, but the audience can't see me. And so I think curtains, because that's the name of it, is that same way. And so there's certain things that have created curtains in our life that doesn't allow the body to see. So those can be physical and non-physical. So example would be BPA plastics, heavy metals. It could be different, the Prior's patch that's in your gut. We have 4 pages of these different curtains that we have found on different people that create issues. We can also have non-physical issues. Here's an interesting one, like your name. Let's say your parents were always saying, Christopher William the Third, and when you got in trouble, well, that's going to be a curtain for you because that's a scary moment, if they're calling me by my first name, I'm really in trouble. So we're going to clear those things that are non-physical that have gotten in your way. Those could be stress, it could be emotions, it could be the phases of the moon. So there's just lots of different things, both physical and non-physical, that we need to clear on you to, again, to have really good testing. What the body can see, it can heal. So we're getting that to be able to be seen. So that's what we go from there. The next thing we like to do is, if you're a first-time client, we like to find out, okay, when did this start and why did it start? Now, a lot of times you may have an idea, hey, 2 weeks ago, something major happened and I've got this issue. Or it could be, you know, I've been dealing with this for 9 years and I don't remember. You know I had a couple surgeries and, you know, this and that, but you know, I don't really know. So we can go back and ask. That's what quantum means. Quantum is, we have this huge field that we can go back and forward in time to find out what's going on in your body. So we go back and we say, okay, is it something external? Is it something external non-physical? Is it something internal physical? Or is it something internal non-physical? And so we find out, and it could be all of them. And so we find out, okay, what is it that's happening that's impacting your life and not allowing this to happen? So it helps us kind of like quickly diagnose, so that gives you some answers. So it could have been a spider bite, it could be a mosquito, it could be an anesthesia, like I mentioned. It could be a fall or a twisted ankle. It could be an accident. It could be a really intense flu that you had that just never left the body and it's kind of just been stuck in there bouncing around. So we find out what that is, and that kind of helps you answer some questions. I'm always about finding the why, and that's how we find the why. Okay, so then from there, if you're a new time client, we like to jump right into saying, okay, what are the pathogens? What are the toxins that are impacting you? So pathogens is ingestants and, pathogens is virus, bacteria, mold, parasites, heavy metals, unknown pathogens, something that hasn't been invented yet that we don't know about. Then it could be also exterior mold like mycotoxins and mycoplasma. For toxins, we find out it says ingestants, inhalants, contactants, and injectants that may be bothering you. And then we have, that's the physical part, and then we have the non-physical part. So is there an emotion? Is there a belief? Is there a blocking belief? Is there a punishing belief? Is there a miasm, a generational issue that has been driving this? So we find the non-physical. So that's really enough to do with our first session. And then what we do is we give you a personal code to read that I call a verbal acupressure code, because it's putting in all those points that you worked with and entered at the beginning of when you signed up with us. And we give you a personal treatment code where you can read those out loud, silently, you can touch them. And I will be sending you another video that kind of deals with how to do your personal code so that you're really understanding that. But that's the first session, okay? So one thing that I really didn't mention that I think it's really important here is to give you a visual, because I'm all about visuals, I'm a visual person. So the visual is, what you're dealing with is like some lightning in your house. So you think about your body as a house. Some lightning has come and like struck the house, okay? And it turned off the breakers and it flipped the main breaker, okay? So when we go back in line, or when we start asking you questions, what we're doing is we're going back on, we're flipping all those switches, okay? Now you may have already gone back and done that, but there may be one that you missed. And so what Quantum Techniques is doing is we're identifying what the miscommunication that's not allowing your body to heal, okay? And so we are going back on and finding out what of those breakers didn't get put back online that's making your body not communicate, not fully heal, not allowing it to know what to do. So that's the visual of what we're doing with your body, okay? So I think that's just really helpful to have that. So that's what we do at our first session, and I look forward to getting started. So I hope this will help you kind of know either what we're going to do or what we did do, and it helps answer some questions. So let's see. Here at Quantum Techniques, I think we said we're trying to help you, what the body can see, it can heal. And the code that we do identifies toxins, pathogens, heavy metals that are not allowing the body to show it what it needs to do in order to be in a healing state. And so we show the body what those issues are so it can heal itself. That's what we do at Quantum Techniques. So I'm looking forward to getting started, and if you've already done a session, I'm looking forward to having you continue to work on your health and get your health and happiness back. So I look forward to working with you again. All right, blessings.